Hey guys, welcome to Medifaction. Today we will learn about the anatomy of coronary arteries. The coronary arteries are the arterial blood vessels of coronary circulation, which transport oxygenated blood to the heart muscle. So, in order to learn more about coronary arteries, let's get started. In this video, I will be enumerating an introduction about coronary arteries. We will also discuss about right coronary artery, left coronary artery, and some of its important clinical anatomy. Introduction. The heart is supplied by two coronary arteries, namely the right coronary artery and the left coronary artery. These are arising from the ascending aorta. Both arteries run in the coronary sulcus. First, let's learn about the right coronary artery. Position. Right coronary artery is smaller than the left coronary artery. It arises from the anterior aortic sinus of ascending aorta. Course. Number 1. It first passes forwards and to the right to emerge on the surface of the heart between the root of the pulmonary trunk and the right auricle. Number 2. It then runs downwards in the right anterior coronary sulcus to the junction of the right and inferior border of the heart. Number 3. It winds around the inferior border to reach the diaphragmatic surface of the heart. Here, it runs backwards and to the left in the right posterior coronary sulcus to reach the posterior interventricular groove. Number 4. It terminates by anastomosing with the circumflex branch of left coronary artery at the crux. This is the circumflex artery associated with left coronary artery. Branches. Number 1. Large branches. It possesses marginal and posterior interventricular branches. This is the right marginal artery and it also has posterior interventricular branches, which comes under large branches. In small branches, it possesses nodal branches. In 60% cases, these will be present. Also, right atrial branches, infundibular branches, terminal, right ventricular, and also cono. These all comes under small branches. Areas of distribution. Number 1. Right atrium. Number 2. Ventricles. Greater part of right ventricle except the area adjoining the anterior interventricular groove. Also, a small part of left ventricle adjoining the posterior interventricular groove. Number 3. Posterior part of interventricular septum. Number 4. Whole of the conducting system of the heart except a part of left branch of the AV bundle. The SA node is supplied by the left coronary artery in about 40% of cases. Now let's learn about the left coronary artery. Position. Left coronary artery is larger than the right coronary artery. It arises from the left posterior aortic sinus of the ascending aorta. Course. Number 1. The artery first runs forwards and to the left and emerges between the pulmonary trunk and the left auricle. Here, it gives the anterior intraventricular branch which runs downwards in the groove of the same name. The further continuation of the left coronary artery is called circumflex artery. After giving off the anterior interventricular branch, the artery runs to the left in the left anterior coronary sulcus. Number 3. It winds round the left border of the heart and continues in the left posterior coronary sulcus. Near the posterior interventricular groove, it terminates by anastomosing with the right coronary artery. Branches. Large branches comprises of anterior interventricular branches and also branches to the diaphragmatic surface of the left ventricle, including a large diagonal branch. These are diagonal arteries, and also it has anterior interventricular branches which comes under large branches. Small branches possess left atrial, pulmonary and terminal. So this is the right coronary artery, this is the left coronary artery, this is the circumflex artery. This is the marginal artery, this is the diagonal artery, and this is the left anterior descending artery. And this is nothing but the posterior descending artery. Areas of distribution. Number 1, left atrium. Number 2, ventricles. Greater part of the left ventricle, except the area adjoining the posterior interventricular groove. Also, a small part of the right ventricle adjoining the anterior interventricular groove. Number 3, anterior part of interventricular septum. Number 4, a part of left branch of the AV bundle. Now let's move on to some important clinical anatomy. Number 1, thrombosis of coronary artery. This is common cause of sudden death in persons past middle age. This is due to myocardial infarction and also ventricular fibrillation. Number 2, incomplete obstruction, usually due to spasm of the coronary artery, causes angina pectoris, which is associated with agonizing pain in the precordial region and down the medial side of the left arm and forearm. This pain gets relieved by putting appropriate tablets below the tongue. Number 3, coronary angiography. It determines the sites of narrowing or occlusion of coronary arteries or their branches. Number 4, angioplasty helps in the removal of small blockage. It is done using a small stent or small inflated balloon through a catheter which is passed upwards through femoral artery, aorta into the coronary artery at last. Number 5. If there are large segments or multiple sites of blockage, coronary bypass is done using either great saphenous vein or internal thoracic artery as graft. So this is what a thrombosis looks like. And this is the procedure of angioplasty. This is the balloon I was talking about, and this is the catheter. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.